Which of the following terms describes the congenital abnormality of the forebrain in which an infant is born with a diminished brain size? A. Agyri. B. Microcephaly. C. Polymicrogyri. D. Anencephaly. The answer is B. Microcephaly. Microcephaly denotes a congenital abnormality of the forebrain in which an infant is born with a diminished brain size. Potential causes include fetal alcohol syndrome, congenital rubella, and trisomy 18. The other answers are all examples of congenital forebrain birth defects. Anencephaly is the complete absence of major portions of the brain, skull, and scalp. Agyri is the absence of gyri. Polymicrogyri is a condition in which gyri are too many, too small, and very shallow. Anencephaly and other neural tube defects have been linked to maternal deficiency of what nutrient? A. Calcium. B. Biotin. C. Folate. D. Beta-carotene. The answer is C. Folate. Anencephaly and other neural tube defects have been linked to maternal deficiency of folate. This is most likely due to folate's role in methylation and nucleic acid synthesis. The other nutrients listed are all important to maternal health but have no known correlation with neural tube defects such as anencephaly. Paraventricular leukomalacia, PVL, is the most common finding on autopsy of newborns with what condition? A. Fetal alcohol syndrome. B. Cerebral palsy. C. Anencephaly. D. Hypoxia. The answer is B. Cerebral palsy. Paraventricular leukomalacia is the most common finding on autopsy of newborns with cerebral palsy. PVL involves the softening of the brain tissue and subsequent death of the white matter. This is caused by lack of blood flow to the paraventricular area of the brain, which results in necrosis and gliosis of brain tissue. Neonates born with PVL are likely to have mental impairment, motor disorders, and compromised vision and hearing. PVL is usually diagnosed with ultrasound of the head. None of the other conditions listed typically present with this finding. A mother 1 hour post-birth expresses concern because her baby's head looks slightly cone-shaped. The nurse tells the mother that A. This is normal and usually temporary. B. This is normal but is not temporary. C. This is abnormal but does not require immediate medical intervention. D. This is abnormal and she should consult a neurologist. E. This is abnormal and she should contact her pediatrician. The answer is A. This is normal and usually temporary. It is normal for a child's head to be slightly misshapen immediately following birth. The infant's skull is composed of bony plates connected by membranes, fontanelles, allowing for accommodation of the baby's growing brain. Caput succedaneum, swelling of the scalp, can also be found following a long delivery. A misshapen head usually resolves on its own and is normal but does not require any medical intervention. A baby is born with a heart rate of 99 beats per minute, irregular breathing, good flexion, frowns when you suction the nose, and with pink color throughout the body and limbs. What is the baby's Apgar score at 1 minute? A. 9. B. 8. C. 7. D. 10. E. 6. The answer is C. 7. An APGAR, Appearance Pulse Grimace Activity Respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the APGAR scoring method, point allocations are as follows. Heart rate of less than 100, 1. Good flexion, 2. Frown, reflex, 1. Irregular respirations, 1. Pink skin color, 2. We add these to get the final APGAR score of 7.